Good afternoon, everyone. So, welcome back to the second session of today's International EFDP program organized by Malla Reddy College of Pharmacy in association with the APTI Telangana branch. Now, I request our principal sir to speak few words about this.
So welcome you all again for this FDP, International EFDP, and we have the speakers from all over the world, and let us have this information, make it useful, and all the speakers are resource persons that are giving very good information. Only the thing is how to grasp those things and how to implement those things. That's most important, and you learn all these things apart from our regular subjects in the pharmacy. Some additional points we have to find out. We have to know the information about the AI, whatever is required for the present day society, present day teaching and all. So we can learn all those things in this 5 days FTP. Welcome again all the participants for this third day, second session. Thank you. Please proceed.
Thank you, sir. So I'm much delighted to.
Thank you, sir. I'm much delighted to introduce our resource person, Dr. Sowjanya Battu. Dr. Sowjanya is a professor in Department of Pharmaceutics with over 15 years of teaching experience. She holds MPharm, PhD, and also completed her postdoctoral in 2017. She successfully guided 47 MPharm students and 3 PharmD students. Coming to her academic and research accomplishments, it includes 51 research publications in various national and international peer-reviewed journals, participated in 42 national and international conferences, and gave 36 presentations, and holds 2 patents and 1 edited book. Ma'am received the Best Teacher Award from ABIPER. She is an active member of IPA, APTI, and SFE. She is well versed in accreditations like NAC, NBA, NNIRF, and QCI ranking in her academic career. Thank you so much, ma'am, for joining with us. It's over to you, ma'am. You can start your session.
Okay. So before I get into the topic which has been allotted to me or which I have chosen, of course, the topic which is given is on AI research and in pharma education. But I would like to give an introduction about first in education and its system. And Gayatri has also mentioned me to touch upon this BPharm syllabus also. So based on that, I just wanted to introduce with this slide. First of all, if we have to talk about the education and its system, if we can see this image, of course, this is an image which I have taken from Google. There's a lot of meaning in this slide. When you read that, learner is the focus of all educational activities. Hello, can I continue? Yeah. Hello, ma'am, can I continue, please?
Yes, ma'am, you can continue. Yes,
Hello.
ma'am, you can. It's audible.
Hello. Hello. Ma'am, can I continue, please?
It's audible, ma'am. You can continue.
I'm getting disturbance. Is it okay? I can continue, right? No. Fine. So yes, so learner is the focus of all educational activities. When you see two images here, one image, a person is making a student sit on the chair and he's giving lot of education through pipe into the brain directly. Whereas another image is an image where a teacher is making a student observe what he wants to teach. Amongst both these images, if I ask anyone, which image is suitable for the current generation education, I consider it as a second image. That means learner based education system is more prevalent nowadays. It is not like I will teach you 1 hour and you have to sit without moving here and there and without blinking your eyes and you have to listen to me. Nowadays current education is not happening like that. So you need to to focus on your education or on our education, and we have to turn it, or you have to take it towards a learner based education. Now, what is learner based education system? We have to educate students nowadays based on the needs of the society. Now, for example, the whole world is running behind AI, Python, machine learning, chat GPT, consensus, all these things. And if I ask them to study only CVS Subramaniam alone and write examination, it is not the updated learner based education. So that is the reason our Pharmacy Council of India, along with in collaboration with National Education Policy, they have come up with a new education system, new education policy, and they have created one new syllabus for B Pharmacy, which includes Python, machine learning, yoga, all these kind of new additions along with the core subjects that we have to teach. And they have changed it. And now everyone is questioning, why should a pharmacy student study Python? Now, when you go to this slide, of course, it is an AI generated slide again. I need to use the technology. Why should a pharmacy student learn Python? Python, if you learn Python, you can gain computational thinking, problem solving, health data, analysis can be done, AI and machine learning can be used effectively. You can even convert the prescription, distribution of drugs, or prescription of drugs into a digital healthcare system, and you can make it as an evidence based decisions can be made. You can do drug discovery by using Python programming, and you can even go ahead with a research on personalized medicine. You can even get a clinical decision support from Python programming and coding. And the whole future of pharmacy is dependent on programming and coding. So that's the reason Python, a subject called Python, now but the word Python is included in the syllabus. Everyone is feeling to which engineering college we have to run to make this Python be understood or taught to our students in pharmacy colleges. But when I heard PCI people conducting seminars and guest lectures, FDPs here all over, I have attended quite a few number, and they were mentioning, although it is Python, even a pharmacy student can also teach by learning the basic courses of Python. And a small advice I want to give, this and all I don't want to tell. One small advice I want to give to the current teachers: since Python programming, machine learning, all these new subjects have been introduced recently into our curriculum, if there are young teachers who can learn Python programming, machine learning, it's not a great deal actually, because NPTEL, SWAYAM, MOOCs, and all are also offering uh, crash courses or value added education courses on Python and machine learning. We need not have to search for an engineer to come and tell that. Little mathematics is sufficient to learn programming or Python programming subject. And we ourselves can be proficient in teaching our students the Python programming, and we become the trend in our colleges, learning a new subject, and we will become more familiar. Who is teaching Python language, Python programming in our college? So and so person. We get that credentiality, we get that importance, we get the significance in our colleges. So now, final slide that I wanted to show on the traditional education system and outcome based educational system, where our Pharmacy Council of India in collaboration with national education policy as framed is traditional education was teacher centered. Whatever teacher knows, she will tell students. Whereas current education system is a learner centered. How can a student learn this topic? Should I conduct a practical? Should I just give a theoretical information? Or should I make them do the workshop or hands on experience to make them learn this topic? That is, learner centered education has come into existence now. And traditional education system, teacher has to complete the syllabus hook or crook. You give 10 days time, she has to complete 5 units, or 100 days time also she can complete 5 units. That is her target. Now, coming to the current generation expectation, competency achievement is required. Okay, if I study this now, students are asking, why should I study this subject even when all the 16 years of my teaching experience? I always teach my students to question 3. What does this topic mean? Why should you study? And when should you implement this? So, competency achievement can be achieved by learner centered education system. Now, traditional education is time based progression, whereas an outcome based education, current education, is an outcome achievement. Lecture dominance is there in traditional system, but student engagement is focused on outcome based education. Traditional education is based on mark oriented. How many marks? Okay, whoever is getting 29 out of 30 is an excellent student, but they might not be using their brain, but they are excellent because the traditional education system is just focused on marks, whereas the current education system is focused on performance. Whether you get 65% or 95%, when I give you a question, how are you answering it? Next, summative focus in traditional is become a continuous assessment. Once you study and get a good rank, you can never be a best student forever. You have to do that continuously for 8 semesters. That's why SGPA will be different, CGPA will be different in our current education system. Now, traditional education is teaching planned first, whereas outcome based education is outcomes are planned first. If I'm teaching this to student, what should be my outcome? So outcomes are framed first, then teaching plan is made first. So I just wanted to overview on this. Why the syllabus is changed is only to substitute the traditional education, which is no more useful nowadays, with an outcome based education with the collaboration of national education policy, where even pharmacy students can use the technology for the betterment of the healthcare. And hence, this is the way we can accept the syllabus change in syllabus that the PCI has put in. So this is what I wanted to focus on before going to my original lecture. I have a lot. I can even talk about this BPharm syllabus because I have been attending certain sessions. But now let us come back to our topic which we have put in the schedule. Now, what and why is research? Research includes the generation of a multitude of ideas leading to new or substantially improved scientific insights with relevance to societal needs. This is the textbook generated definition for research. For me, a research is something which is there in the universe. The Almighty has already set something in the universe, but nobody found it. You need to go and search for it. When you can search it, when you think about it, when you want it, when you get an idea how to go and search it, when you get an idea of how, when to go and search it, when you get an idea where to go and search it, you can do that searching and find the product. So the basis for research is an idea which will lead to a substantially improved scientific insights, and any research without societal benefit or without relevance to the societal needs, it is not acceptable by the government nowadays. There are two types of researchers. theoretical research and empirical research. Theoretical research is totally concept oriented research where you will have to go for a field analysis, literature surveys, reviewing of the literature, analyzing the literature, taking the case studies and analyzing it. But there's nothing to do it in the laboratory. Whereas empirical research is something which you have to go and do the bench work in the laboratories. That means experimental research is an empirical research is an experimental research, where empirical research will focus on the experiments, the observations that you found, the measurements that you do, and the analysis of the data, then which continues with the manuscript writing and finally the publication of it. So, compared to the theoretical research, empirical research has a lot of substantial data to prove that this research is beneficial for the society. So, because we will be involved in the experimentation part, observations, and the data analysis will be done. So, again, connecting the B-Form syllabus, Python can be used for data analysis also. Machine learning can be used for data analysis also. And the AI tools which we use are very much helpful for manuscript writing. When I educated my students from the past 16 years, of course, leave this last 1.5, 2 years. Yeah, 2 years at least you can leave. 2 years before, when I was asking my students to write a manuscript review paper, I used to tell them only one point. What is that? Is minimum 100 to 150 articles you have to refer in order to write a manuscript. And to refer 100 to 150 monographs or paper publications, minimum thousands of articles they have to refer. They have to search for thousands of articles. In that thousands of articles, minimum 100 to 150 articles they have to download and see the relevance of their topic that they have to write the review paper, and then only they can write one manuscript by referring all the 100 references, citations and all. But nowadays this AI is making it more easier. When you use the AI tools for research and literature survey, you can get literature of 100 to 150 articles in not more than 10 to 15 minutes. So that's the reason AI tools are playing a vital role currently in literature survey. But one thing again I wanted to say, that how to use AI, till what you have to use AI, how much to use AI, and the borders and the boundaries of using AI also is very important. Hence, I can reframe all this information as ethical usage of AI in research will definitely be helpful for the current researchers. Now, traditional way, a research statement, you will you will have to get one research statement. Either a mentor or a guide will give you a research statement, or a student researcher will come with an idea, and finally the guide and a student. Just a second. Yeah, a guide and a student will
Canteen plus transport here.
guide and a student will find out or come up with one research statement. After coming up with research statement, guide will say go and do an extensive literature review, which will have to improve or increase the creativity and creative thinking and imagination of the student on that particular research topic. Then the research topic after literature review will bring in some ideas on one research topic to a student. Then that research topic can be discussed in between guide and the research student, and you will get one research question. Now, for example, recently I've gone for one evaluator this thing. One student has presented a paper. The way she has communicated was very excellent. She has explained her whole project very nicely. Then I told, your project is not at all a novelty and it is not acceptable. Then she asked me why. Because on what basis have you selected this drug? She has selected ondansetron to do a chewable gums or gummies. Chewable gummies on ondansetron. Oh, she has done a wonderful project and she has presented it more wonderfully. But when I questioned her what is the taste of ondansetron, then she said bitter. I said it is intensively bitter. Then how can any patient chew it in the oral cavity when the drug is so intensively bitter? So a research question should be answered before doing a research. The suitability of the research topic or research question should be answered with hypothetical analysis, with theoretical knowledge, with literature survey, and then only you have to go for its objectives and make you yourself understand the significance of your project. Till you understand that it is significant to do this research, don't go inside the empirical research. Stop your research at theoretical research only. First of all, you should understand, is this drug suitable for this formulation? Is this formulation suitable for this drug? Is this formulation required for this drug? So many research questions you have to answer through the literature review. You have to hypothetically analyze, understand, and see that the objectives and the significance of your research topic is very well justified and defended. Then only go for a empirical research. Now half of the project or half of your research is done till you do your significant study or through theoretical research. Now coming to the whatever you have information, have to do one design, do the methodology, go into the laboratory, perform those methods to formulate it or evaluate it, then tabulate the data, analyze it whether you got the right results or not, conclude the research topic, not research topic, and publish your details. Publish your details in a manuscript or in the form of a thesis. Now, critical steps to create a successful startup research. This is not. Why do we need a protocol? Yeah. Now, as what I explained you, the theoretical research, we consider it as a protocol, where protocol becomes a roadmap to achieve your goals in the research. It is the critical first step in a successful research undertaking. That means you do a lot of research, literature review, and find out stepwise procedure to go ahead to achieve your objectives and the goal or aim of your research. Hence, the protocol plays an important role, very, very important role. Which will come and correlate with your creativity, creative thinking, and an idea. If you're able to think, you will never be out of ideas. Thinking helps you come up with new ideas. So think instead of thinking of useless things which will not help us anyway. If we can think of research, pharma, what best I can do, you can get 100 number of ideas, filter them, and come up with a new thoughts, new research which is helpful for the society. Now, ability to think creatively breeds the confidence in us, which builds character strength. Producing original and honest work will not only reinforce students' critical thinking skills but also reflect well on the institutions as well. Now, after you get an idea can be divergent or idea can be convergent. When it is a convergent idea, you have to narrow down your thought process, come to one logical thinking, and you get a brilliant idea. In a divergent thinking, you have to involve 10 to 15 people minimum in your idea detection. That is what our R&Ds in industry will do. It will not go and the industries will not come to one conclusion that this is a brilliant idea without even at least involving 10 brains in one particular idea. After identifying a brilliant idea, you can either go for a research grant or you can select a research topic. 30 minutes. Either you can go for a research topic, find a research question, think about it, produce objectives, and go for a research. Or this brilliant idea, you can even do a research and publish or sell your idea to company also for your successful career and innovation. Coming to the concept of evolution of academia. Earlier, whoever used to publish, if you can see the first image of mine, whoever used to publish one manuscript, they used to be like, great people in the institution. Oh, she has a paper publication or he has a paper publication. Then the academic institutions told either you publish or perish. Then people started publishing like 10 publications in a year, 5 publications in a year, 20 publications in a year. When you see, pay 1,000 rupees, your paper will be published. So many new journals also have come into existence, making use of this concept of academic institutions saying publish or perish. You will not be in the institution, you will not get incentives, you will not get increments if you don't publish. That is what was taught 10-15 years back, at least 10 years back. Then everyone were like 1,000 rupees. Okay, in 1,000 rupees, one journal will publish one manuscript. What you do? Include 4 people, collect 250 rupees, and give some or the other manuscript, and they will publish without even knowing the genuinity of the research, without even authenticate whether the results are correct or not, whether the project is right or not, whether even the title is suitable or not. No, nothing, only publication. Later, in after years, it has become academic institutions have understood that they're simply publishing fake papers. Then they came up with publishing in high impact journals or perish. Then people started sitting properly and studying it, finding out the good impact factor journals. That's where the UGC Care journal list has come into existence. And in UGC Care journal, we select one journal. Next year, that journal won't be there in the UGC list. Next year, one more journal will be added that will not be there in the next year. So somehow people started publishing in impact factor journals or elsewhere journals, Scopus Index journals, and all. Then he was little surviving better. Now the academic institutions have evolved to speak about publish frequently in high impact factor journals and maybe you won't perish. So when the scenario has evolved from at least do a publication to publish frequently in high impact factor journals, I will see that your job will not go, is what our condition is. So that means research has become a part of academic institutions now. if any institution employee has to survive or keep up their job, you need to be a researcher. Now, what kind of a research should we do? Scientists must not only do science but must also write science. Now, so many times my students used to come, and when I was doing PhD, I used to say, I'm following exactly the same method, but I'm not getting results. Because the scientist who has published the paper has really not written the science well. Now, research outcomes are measured through quality publication only. Now, what is this quality publication? Now, let me answer the first sentence. Not everybody is great in narration. You can use the AI tool in narration, but the information should be given or fed by you alone. The information should be fed by the scientist to the AI, and only writing part AI can do, so that that can be narrated in a better way, so that another scientist who wants to do a research on the same topic can understand it. So, not just doing science is important, writing science is also important, and hence our current education system, learning Python programming or machine learning, design of experiment software, QBD, quality by design softwares, AI tools like consensus, etc., and etc., will definitely help us to write a right science, whatever we have, to write science in a right way, what we have done. And coming to the second point, research outcomes are measured through quality publication. Now, how does the quality be defined now? If your publication is indexed in certain, publishers only, it is a quality publication. You need to check in which journal you are publishing. Hence, a story of journal search also has become one research now. There are journals which are called predatory journals, cloned journals, hijacked journals, which are just doing, they will write International Journal of Pharmacy or something, or Indo-American Journal, or African Journal, that journal, this journal. And the researcher or a scientist who is seeking to publish the data will think, oh, this is an international journal and I have to publish in this. No. Not every journal which mentioned the name international is an international journal. You have to go check their website's homepage. At least one or two issues that they have published. Whether there are really international people who are publishing, international people who are evaluating your paper, or in the board members, or in the editorial board. Based on that study, you have to go one journal. For example, you've taken or shortlisted 10 journals, go to their websites, check what is their background, who are their editorial board members, what are their issues, what is the type of work that they are publishing, who are publishing in it, who is evaluating those papers. There are certain journals who will say International Journal of Pharmaceutics, International Journal of Pharmaceutical Sciences, International Journal of Pharmacy. You will just see International Journal of Pharma. Means some journals will be coming in the drop down. You will click something. You will think that that is a good journal, but it is a hijacked journal. It has hijacked the half or 70% of the name of a very good reputed journal. That's why the Google drop down box is wrongly diverting you towards this particular hijacked journal. And the next type is researchers should not waste money. This is my concept as well. There are so many journals. Yes, there are Q1 journals, Q2 journals. Based on the importance that we are giving nowadays, even journals are charging more. But there are journals at least at the initial steps. You can publish in journals which are free, but they are good journals only, instead of wasting money on predatory, cloned, or hijacked journals. And please do not publish if your data is not trustworthy, because we are, in that way, we are polluting the science. So, having keeping this, now if you have one aim, if you can see the boat which is which they are sailing, blue color shirt color people are sailing everyone in one direction and the boat is going happily. Whereas, although the boat is too big, although the boat has so many number of people, but each one is sailing in different ways, different directions, wherein the leader who has to lead the sailing is resting, then the boat will not reach the goal. So, have your aim properly, form a team, be under a proper leader who can guide you or sail you in the right path so that your research will be successful. This explanation on predatory journals and hijack journals will be taking a lot of time, but I can share this screen to the, yeah. Constructing successful literature searches using a variety of biomedical databases and search engines. If you want a constructive and a reliable literature or an information on your research topic, just use these literature search engines: Science Direct, PubMed, Jane, Embase, Web of Science, SciFinder, Sinal, International Pharmaceutical Abstract, Scopus Journals, Google Scholars, PubChems, and all. SWOT analysis for scientific outcome in terms of research publications. Indexed publications like SCIE or Sci Index, Scopus Index, PubMed, Medline, Scopus. The threats are predatory publications may be possible. And the strategies: quality versus quantity, focus on quality rather than the quantity of research publications. Now, getting good Web of Science is a challenge now, because people are publishing papers in hijack journals, low quality journals. The strategy could be high class training should be introduced by the institutions to train the teachers and students to understand what is the significance of Sci Index, Scopus Index, PubMed, Medline, etc. What is the challenge now in research publication? Getting good H index citations. So the threat is paper mills are producing so many papers. The strategy: robust peer review before submission of research paper for publication. How to get now the threat challenge is getting good item index. The threat is fabrication of the data, falsification of the data, plagiarism is not letting get item index citations. The strategy is proper journal writing. So now I want to show you how to use this AI tools in research writing. There is a, first, everyone will use ChatGPT. AI means people will use ChatGPT. When I go to ChatGPT and I want to search on formulation and evaluation of nano emulsions. Yeah. If you can see the screen, ChatGPT has given me this information about nano emulsion. Okay. Now, I type the same question once again to the ChatGPT. Just a second. Just a second. I think internet issue. So this is an information which has been generated by ChatGPT. But if I give the same question once again and enter, it gives another information. Now, what is the authentication that the information given in the first time and the information given second time, in both the informations, which information is the right information? We cannot understand using ChatGPT. So, for researchers who wants to really do a proper research, we should not go for ChatGPT. We should go for certain AI tools, consensus, consensus, open consensus, and okay, we have to register through our mail. I'll go through Google. I think internet issue. Yeah. So Yeah. I'm signing in through the Google or Gmail to enter into consensus. Yeah. So I'm a faculty, you need to register yourself. Come later. I'm just showing step in consensus.
Ma'am, you can continue now. Please share your PPT back.
Yeah.
Ma'am, you can
I
continue now.
share.
Please share your PPT.
So when you see the consensus, you have the information of nanoemulsions with the references. If you click on the first one, see, it is showing you in what is the topic of the journal it has got the information from. See, this is the information that has been given by the consensus on formulation and evaluation of nano emulsions. Now it is even showing, when you see this image, you see this paragraph of introduction on nano emulsion is being taken by this reference person, and this reference person, this reference person, this, and two more references are all there. It is giving you certain consolidated information along with literatures and references also in which it has searched. Now tell me, the information which is generated by ChatGPT is more authenticated or reliable, or information given by consensus is more reliable? Is consensus more reliable? I'm just telling you only one tool today. That means after you get this information, it is not like I'm not just telling you to copy paste. Read the information, go to this particular reference, create your own sentence. It has given you some consolidated information to understand about what are nano emulsions, what are their methods of preparation, what are their applications, what are their evaluation tests, and all. Take this information, take these references. In 10 minutes, you can get hundreds of articles only on nano emulsions. So this is what is the way that you have to use the technology, not just, okay, consensus has given me information along with references, I'll copy paste and make a journal. Again, it is a falsified publication. It is a fake publication. So yes, technology is very, very advanced. Technology is useful, but how we use, how much we use, when we use, where we use, how we use, ethically, authentically, is more important. So instead of going for the next AI tool which is used for research, I think it is okay if I can stop here, because it's going to take some time to explain other AI tools as well. Let's see it in the next class or next time when it is possible. Over to the host of Malla, Reddy Institute of Pharmaceutical Sciences. Gayatri? Gayatri? Yeah. Thank you all. Thank you for your patient listening.
Yeah, no, it's here.
Thank you all. Thank you for your patient listening.
Thank you so much, ma'am. We are much privileged to have you. Really, it's a wonderful session and it's very informative, ma'am. So, start here.
Now
Am I
we
audible,
can.
ma'am? Yeah. Really, the session is very informative, ma'am, and it's really encouraging also. You have told some things regarding the education system and how to handle the students in worst cases also, like traditional and outcome based learning, how we have to handle nowadays. Really, as you said, students are very they are ready to teach us by using these AI tools. So that is why in my view we have to develop much more by learning all these AI tools. It will be really useful for us so in research orientation way and also for teaching purpose also. So I have a
Thank you.
question, ma'am. So how you have told some regarding the duplication of these journals, how we can identify that? How we can identify
Uh,
because they are paying
may-
lots of money, like it's minimum in thousands, like 30,000, 50,000. It may be in lakhs also, but it is a
yeah.
cloned like that.
I can actually do a workshop on it, how to choose a right journal. I mean, at least 1 hour of workshop kind, where everyone has to sit on the laptop and do. But if you want me to explain how to check a right journal, no, there was one slide. Anything which is reflecting in those particular websites, like I've shown you PubMed, Scopus, Google Scholar, and Jane. That one slide I have shown you. If you want, I
Yes,
can show
ma'am.
it
Yes.
once again. Yeah, I'll show it once again. Yeah. Yeah. Any publication or a journal mentioned in these search engines is a good journal. This is what a small information, very useful information I can tell. Otherwise, I can even tell how to choose a journal, pharmacy journals and all. It will take a long time. At least 1 hour of workshop session is required to make you understand what is a predatory journal, what is a hijack journal, how to identify that and all. So anything which is published in these search engines will be a good journal. That is
Yes,
a
ma'am.
gist.
Yeah. So our participants are asking for your PPT to share your PPT, ma'am, for them.
Yeah, I can share it with you guys, and you can share it.
Yes, Institutes I want to speak with you. Yes, so nice to meet you, ma'am. To this session.
Same here. It's like homecoming for me. I worked for CMR quite some long time,
Oh,
11 and a half years.
okay.
So Sudhakar sir, Ablu sir, Malla Reddy sir, Gopal Reddy sir, all of
Mm,
them are, we worked along with it. So
okay.
it's like homecoming for me. Hello.
Okay. Madam,
Hello, sir.
audible, madam? Good, good. You have spoken very
Um,
well. After a long time, we are seeing you on the
yes, sir.
screen. It's a very useful information for all the faculty, okay, all the
Thank you.
staff.
Thank you so much.
Only the thing is that implement. Of course, we must implement now onwards all these things, tools and all, whatever you said. Let's conclude. Emma?
Thank you. Thank you. Thank you so much. Thank you, everyone. Thank you for the opportunity.
Thank you, ma'am. Thank you. So, to our participants, the feedback form will be posted soon in the WhatsApp group for both the session, the morning and the afternoon session. So, kindly fill that. And attendance is also mandatory to get your certificate. Thank you so much. We'll meet in the next session tomorrow morning at sharp 10 a.m. 10 a.m. 10:30.